Good afternoon, everyone. So we are talking in English. For the questions later, we can take it on in French as well. But for lieu si emblématique, historique ici, I will pass now in English. It's a pleasure being here in this wonderful city in Paris and to talk about an important topic, evaluating the evidence of respiratory therapies on anxiety disorder and the implications for clinical practice and future research. So we are currently in a crisis, it's a global crisis, the anxiety disorder crisis, and there's a rise since the COVID-19 pandemic. After the pandemic, there was a rise in the burden of depression and anxieties. And this disorder affects over 300 million people globally. And there's continuously a rise, especially in the younger generations. And with this along comes usually treatments, traditional treatments such as benzodiazepines and SSRIs. And those medications usually come with side effects. And this particularly leading to a growing interest or in alternative or complementary therapies such as breathing techniques. So as you heard in the introduction, my background is in emergency medicine. I'm a trained paramedic, so I know all the emergency, and I saw the rise of mental health disorders during my time in Germany and in Italy. And trained by as opera singer, so I know to control the breathing and the positive impact of controlled breathing. And we are not learning, okay, this is happening in the body, but the effects are just tremendous. It's like a natural cocktail of neurotransmitters in the brain while singing an opera area. And it's such a pleasure. And then, which brought me to neuroscience, and that's what you hear today, all the combination of the knowledge from research side, but as well like a tip of the artistic side, and to think together about it in your activity or in your profession, how you can implement it in your daily life. So when we are talking about anxiety symptoms, I think we are all used to it, because already right now I'm speaking in front of an audience, like here, physical and online. I don't know who's watching. This could cause anxiety. My heart rate is a bit up, my breathing is a bit quicker, so all the physical symptoms. But when we talk about physical symptoms, we have as well like the cognitive symptoms, like the worrying and all the stuff, the racing thoughts. And then we have the behavioral, the avoidance. So common, for example, in a setting like universities or schools, the avoidance of an exam. Or in different settings, after an event, and the post-traumatic stress disorder, people avoid a certain situation. And we have a list, and you certainly can see, or you can think about now with your memory about a certain situation in your life, and some of them are quite often. But the problem is anxiety is part of life, the stress response. But if it's hindering, blocking my proper functioning in society, then we have a problem with talking about a disorder. So breaking the anxiety spiral is something I need to mention. As soon as you notice what's going on in your body, your brain thinks, oh no, this must be really bad. And you get more anxious and more anxious and more anxious. It starts usually with a thought. The thought becomes an emotion, a feeling, and this leads to a behavior. And this could be like a spiral. And then we talk about, can we manage this or not? It's a simple question. Are we aware of it? Are we conscious about it? And can we manage a stressful, challenging situation? Yes, what we can see here is like a cloudy sky, And this is something we need to touch, and I really want on the talk this morning, about the Buddhist approach. Feelings come and go like clouds in a windy sky, and conscious breathing is my anchor. We are not here, we are at a scientific congress. We are not in a woohoo seminar, and I talk immediately about it. The breathing is a physiological process in the body. Sure, we talk in spirituality, esoteric, but here it's purely scientific. So it's really important to see breathing is something we are doing every day. It's the autonomic nervous system, and we don't think about it. You don't think about, now I take my next breath. Do you have an idea how many times per day we are breathing, in the average? And the question now in the audience, to make it a bit interactive. $1,000, I don't know, more. So between 17 and 20,000 times when I talk about the inspiration and expiration. It's something so usual, it's the breath of life, the first breath in our life and the last. It is a symbol of life. So, and I want to emphasize the conscious breathing and the so-called unconscious or involuntary breathing. And we go deeper now in this topic, because I invite you to do a short breathing exercise. Oh yes, don't fall asleep, it's to relax for the relaxation. And if you are watching online, I invite you to do it in front of the screen. You can close your eyes. So, comfortable position, I'm your captain now speaking for this short breath journey. So I have the microphone, but please the right hand on your chest, the left hand on your belly, and then take a deep breath through your nose, and then exhale through your mouth. Once again, we do now the equal inhalation and exhalation. 4 seconds in, 4 seconds out. 3, 4, and exhale. Once again. Now we are on equal inhalation, exhalation, and now we go more on the exhale. So, for example, 4 in, 6 seconds out. So, inhalation and exhalation. In your own rhythm. Last time. And when we are going like, yes, we come back, we are landing, we're coming back from this breath journey, yet so simple, but so efficient. We go now deeper in the science. And when we start being conscious about our breath, I feel like this anchoring part, like really like the anchor. Maybe you felt as well. Your mind is a bit wandering, you meet a lot of people, a lot of input, and sometimes just pausing. We come to it back later. So there is some studies, because I emphasize the nasal breathing, that the rhythm of our breathing can influence neural activity in the brain, impacting cognitive functions such as the emotional processing and memory recall. And here we emphasize the most compelling evidence highlights that inhalation, particularly through the nose, can improve memory function. And this is really, really interesting, the difference between the nasal breathing and the mouth breathing. And we just had the number, 17 to 20,000 times per day, and a lot of people in the population are bad breather. Usually go in the chest, over breathing. So when we go in this 4-6, what it just did, you go on a respiratory rate of 6, which is super healthy for long sustainable health. And people outside, for people influenced by stressors, are over breathing, and this comes in this stress cycle. You heard about it this morning. Over breathing, you're sending a signal to the brain, some are not safe, and then it's the bidirectional communication between the body and the brain. So I want to go a bit deeper in the brain. So some of you maybe is familiar with, so we have the visual cortex, which is located here in the back. And then we have the amygdala, the fear, the emotional center of the brain, which consists of the limbic system and the hippocampus for memory and learning. And then we have the prefrontal cortex here, which is for higher cognitive function and for the thinking and processing. So here we have a system, the threat system. So we see a threat or we hear something, which is maybe we remembering a threat. And then we have two ways. We have the unconscious way, the defensive survival circuit. This is like in our brain for hundreds of thousands of years already ingrained when we still lived in the savannah and there came the tiger. So this is something unconscious. This is sometimes there's a threat, you want to cross the street and you are seeing a car, you don't think about it, you're just acting. This is unconscious. And then we have the conscious part. This is like with the prefrontal cortex, the communication between, for example, we see something, then we have the processing, the emotional, and the amygdala, and then we have the conscious decision. And this is kind of the two systems of a threat processing. And then we talk about anxiety with both sides. Yeah, so sometimes it's based on a conscious experience. So we talk about PTSD, the post-traumatic stress disorder, based on a experience in the past, or a threat with this defensive survival circuit. And then we have here the fear around with sensory, semantic, something you hear about something, talking about someone is talking about something, and is immediately, tomorrow I have an exam, and the response immediately is like the fear center in the brain, or an episodic memory, something happened in the past, and you think about it, which becomes then conscious. This brings like the brain in arousal, in a physical arousal, in a stress response. So the breathing phases and the type influence our emotional excitability. And this study is really interesting here done. There was a nasal respiration and trains human limbic oscillation and modulates cognitive function, which is very impactful, just by breathing through the nose. And it investigated how the rhythm of nasal breathing influences brain activity in different parts of the brain. So we had the nasal breathing and the mouth breathing. And you can test it, do it yourself. Yeah, the difference when you just consciously breathe with your mouth. It's like stressing for the body or through your nose. And there's definitely an impact on the cognitive function here, and we can see by the nasal breathing, the anxiety goes down, the calm goes up, depression, like a state of depression, goes down, and for sure like an improvement of sleep. Yeah. So all on the right side you can see all the benefits and immediate, within minutes of nasal breathing. This morning, I think he did not mention the vagus nerve, so it is worth to mention the vagus nerve. It's the longest cranial nerve in the body and extending from the brainstem into the abdomen. So you need, it's really, vagus nerve from Latin means a wandering nerve, which wanders through the body from the brain, which goes through the organs, like you can see here. Like the vagus nerve goes to the lungs, to the heart, liver, goes down, and intestines. So, which means there's a correlation because it is part, the vagus nerve is part of the parasympathetic nervous system, and plays a crucial role in regulating the many involuntary bodily functions. And if you think about it, it's quite powerful and impactful, because with a conscious breathing, what we just did before, we can go in our brain, in our body, and we go in our nerves, in the vagus nerve, and we can, within minutes, come in a mindful, restorative, calm state. And just think about your daily life. Daily life is stressful. The global anxiety crisis, is the fast-paced world is a challenge for us. Family life, professional life, career demands. There's a lot of things. And so if you just have a tool with you, a natural tool, to implement it in your daily life or in your therapies, something as a complementary therapy in your daily life. So maybe you did it before, but as a trained singer, I need to emphasize the role of the diaphragm. The diaphragm is located where? Below the chest. This is the diaphragm, this is the main muscle, the breathing muscle, which is really, really important. Not only for singers, for sure that's like the instrument, but for everyone. Because with the diaphragmatic breathing, or the so-called vagus respiration, you just heard about the vagus nerve, there's a study that vagal breathing refers to deep, slow breathing that stimulates the vagus nerve, you just heard before, a key component of the parasympathetic nervous system. The nervous system, you have two branches. You have the parasympathetic nervous system for rest and digest, the popular science, and you have the sympathetic nervous system for stress, for activity, which is important. It's not a bad thing, we need it for the reaction. And this vagal breathing controls the body's rest and digest functions. So with vagal respiration, it helps down to slow the heart rate, to reduce stress and promote relaxation. Because the activation of the vagal GABA pathways, so this is more complex now. The GABA pathway plays a critical role in reducing the neural excitability. Yeah, so there's a connection with the breathing and the diaphragm and the prefrontal cortex, and this pathway is activated with a slow respiration. So this was a study done here to mention the mindfulness, a tuning function of the brain to the parasympathetic mode and positive states was observed here with the participants, and the breathing training of 20 sessions over 8 weeks with a real feedback device for measuring the heart rate variability. It's the time between each heartbeat, the measuring. An average breathing rate of 4-6, you just did before in our exercise, per minute. So there was the result in this study. In summary, diaphragmatic breathing can improve attention, arousal, physical arousal, mood, and lowering the cortisol levels, the stress hormones. And cortisol levels are parts of life. Think about your morning. Sometimes the morning is stressful. What are you doing? Brushing your teeth. And in the morning there's a cortisol spike. Why not add some breathing exercises like vagus respiration to your breathing, to your brushing your teeth? Don't leave the house before a vagus respiration. There should be maybe a takeaway. So shortly I come about the stinging techniques, because I just quickly want to mention during the COVID pandemic I launched in Switzerland a course for long COVID patients. It was an online course due to the social distancing, where I work with clinics, with hospitals, with the long COVID patients. And I had the idea inspired by the NPIS program in the UK. We have a long COVID patient, we have a clinic. The medical ward was overwhelmed with the pandemic. And first of all, we thought it was a respiratory dysfunction, but now we know there are many symptoms, and especially its impact on the brain. But I launched this program, and I just want to highlight it. because we used the singing techniques, diaphragmatic breathing. We have this group setting, and we had an emotional component, which is really important. And I want to emphasize just the intersection of the science and art, and for the motivational part of the things, because only doing breathing exercise could, for some people, not be like the way, but link it maybe with singing and voice production. It's really, and by the way, humming activates the vagus nerve as well. So really, yeah, and we did like surveys with the participants, and we saw really a reduction in the anxiety, and as well in the increase of the quality of life. So just a simple intervention and combining different elements can make quite an impact. The resonance breathing is a controlled breathing technique where individuals can breathe in a slow pace, around 5. They go below 6, 5 to 6 breaths per minute. And this maximizes the heart rate variability. So we have the heart rate, indicators the heart rate, which is rhythmic, it's a good sign. But the heart rate variability, it's what I mentioned before, the time in variation between each heartbeat. And if you have vagus breathing, or you're practicing, you're doing vagus breathing, it makes us more resilient, and it increases the heart rate variability, which is an indicator of a good nervous system function, autonomic nervous system function. Because with vagus breathing, we are activating the vagus nerve, the parasympathetic nervous system, and we come in this relaxed state. So it leads to a more positive mood, as well as an optimized low frequency, high frequency ratio. It's important for the heart rate variability, and even a reduction in systolic blood pressure. So we have an impact with breathing on our cardiovascular health. The increased parasympathetic and decreased sympathetic, so for the activity, was observed after practicing in this study resonance breathing for 20 minutes a day for 4 weeks. Cognitive abilities were improved and the perception of stress reduced. And this could reduce anxiety and stress and improve cognitive performance as well for high performance, for patient setting, but high performance as well, and reduce cardiovascular morbidity. So in this study, there was slow-paced breathing. Slow-paced breathing is like the exhale is longer than the inhale, and it calms down the central nervous system immediately. In this study, there was a visual cue. There was a drop of water moved up, and the participants had to inhale, and the drop of water moved down, the exhale. And it was done for several weeks, and at the first inhalation and exhalation duration were equal. Just we did before, 4 seconds, 4 seconds inhalation, 4 seconds exhalation. And then little by little the exhalation became longer than the inhalation. And then we saw really an impact here on the parasympathetic nervous system, which is an indicator of the high frequency power. You see it on the left, the younger participants and the older, and we saw an immediate effect on the stress response, on the body stress response after doing this exercise with a visual cue, like something, to have like a rhythm. And for sure you can do breathing without devices or visual cues, but to be really precise, it's really important. So I want to mention as well that anxiety specifically, or panic attacks, there you can see patients can be influenced by lowering regulating the respiratory rate. This non-pharmacological crisis intervention for immediate panic attacks and anxiety disorders in general, but also for more complex situations that can be accompanied by panic attacks, continues to be a therapeutic challenge. This is really like, in the clinical setting, a real challenge. In an inpatient setting, there were 100 patients who were randomized to receive either an offered to breath with the pneumo breathing trainer, just talk about later, which is preset for the inhalation and exhalation of the device. And after completing the state trait anxiety intervention to measure situational anxiety or with a talk therapy intervention by trained nursing staff. And the results, a total of 102 panic attacks were treated in 42 patients. And the state trait anxiety intervention survey could be significantly improved by reducing the respiratory rate. And this was with a device. And it can lead to autonomous management of panic symptoms, which makes the patients, when I talk now in therapy, it's a self-empowerment. So I think a really important part is the self-responsibility of the patients. Give them tools, not only in clinical, but what can they use outside of a therapy session or in a clinical setting. So my colleague, Professor Löw in Germany, psychosomatic medicine and psychotherapy, the professor at the University of Regensburg, he is actually doing a physiological, haptically triggered respiratory phase modulation, which uses situational anxiety in panic patients. And this is ongoing at the moment with this pneumo breathing trainer, which is a preset rhythm of 4 inhalations, 6 seconds exhalation. A tool for everyday life, something you should have in your pocket, like your toothbrush. You have your pneumo breathing device. Optimized technique, this is another really interesting study, the cyclic sigh. There were the study aimed to investigate the effects of structured breathing practices on mood, physiological arousal and well-being. And this assessed different breathing techniques compared to mindfulness, meditation, and how it impacted emotional and physiological responses in healthy individuals over short-term periods. Just to shorten now, so we have the different physiological sigh, the box breathing, it's like inhalation, holding your breath, exhalation, holding your breath. Really good focus. Athletes are using it, snipers, elite police. Cyclic hyperventilation. Hyperventilation means the inhalation is longer than the exhalation. You're stressing your body. And you know Wim Hof method, it's like more coming in the hyperventilational part. And then the mindfulness meditation. We heard about this morning and all the positive effects. Yeah. And daily 5-minute breathwork and mindfulness meditation improve mood and reduce anxiety. This was done here in this protocol. And breathwork improves mood and the physiological arousal more than the mindfulness meditation. This was in this study. And the cyclic sighing is, according to this study, was done in the US, is most effective at improving mood and reducing respiratory rate. I don't know, maybe you heard about the cyclic sigh. What is it exactly about this finding, like at the top? The cyclic sighing can help breathe anxiety literally away. So it's how it works, something you can take away in your toolbox. Deep inhalation, the initial deep breath fills the lungs. Then a second deep inhalation. And then slow exhalation. The cyclic sigh. And it's the most effective within minutes to lowering anxiety and to improve the mood. So in Wonderland, imagine what if. I know it is in some clinics and therapies, depends, it's already in daily practice. But how we can implement it across the board, like in hospital settings, in educational settings, treated in primary care settings with breathing techniques. And I want to emphasize hospital settings for nursing staff, for doctors, because the outcome would be incredible in a stressful environment, and as well in educational settings. Yeah, because the stress and the global young mental health crisis is a real issue. So there is something, as well in this congress, and I'm happy to discuss and put it further on a broader level, how we can implement it, like in short, practical toolboxes for each and every one. So the future research and clinical implications, for sure it's accessible, it's easy to teach. It could be taught in universities, future medical doctors, nursing staff, in emergency settings. It's non-invasive, it's non-pharmacological, and it's cost effective. And for sure we need to see the long-term effects. If I do now the breathing exercise, I see an immediate effect on the nervous system. It's once, but how we can do it, the balancing between the autonomic nervous system, the parasympathetic and the sympathetic, how we can do it and see the long-term effects. And definitely when you're working a therapeutic setting like cognitive behavioral therapy, there's a really good start. You start with your breathing exercises before starting your therapeutic setting with your patients. So there are a lot of areas, like in medicine, in psychosomatics, for sure, emergency medicine. I know it, paramedic, not only for the patients, for the paramedics as well, because becoming more resilient. But there's another story, obstetrics, treatment of impulse control, eating disorders, obesity, real obesity crisis, and for substance abuse. And for sure, in pulmonary rehabilitation, such as COPD or asthma, to pace down the patients. And having something for the patient journey, something in the rehabilitation, and then, for example, having devices, tools to give the patients to have, tools they can use in their everyday life. Therapeutic setting, but we're talking about prevention as well. So prevention, care setting, and therapeutic setting. So, for future studies as well, is there potentially a reduced reliance on medications? Would be interesting. And improve patient self-management, which is really important. And when we come talking about, I'm particularly interested in prevention, precision medicine, then it's really important the self-empowerment part. The patient has to become self-responsible and self-empowered. Wide access to mental health care, especially breathing techniques, preventive impact, we're using already in school settings and in curriculum, students, universities, and potentially, my question could be, this could be potentially used to decrease healthcare costs. So, conclusion and takeaways. There's definitely, and because it's done for several thousand of years, breathing, we know it, but now from a scientific point of view, there is a promise in managing, improving anxiety. We heard about the cyclic sighing and the slow-paced breathing for better autonomic nervous system function. For sure, it's not a standalone therapy for many disorders, diseases, but complementary. And it should be really into the complementary strategies, approaches in daily settings. Self-empowerment, you heard it several times, but I really emphasize of the patient. This is a really important part now in the future of a sustainable healthcare system as well. Further research and future research needed for long-term efficacy and standardization in treatment protocols for complementary therapy. So in different disorders, this should be implemented as part of it for therapeutic settings or as preventive measures. And as we come to an end, now the end is near, as Frank Sinatra sang, and the final curtain, yes, how can we as practitioners, researchers or advocates, all in this room, online, out there, help bring these low-cost accessible techniques into everyday practice, ensuring they reach the individuals who need them most for prevention or complementary therapy. I'll leave you with this thought, and I'm happy to take on questions. Thank you very much for your attention, and let's continue the conversation.